The U.S. Department of Health and Human Services published its peer-reviewed study of the medical dangers posed to children by procedures that the left misleadingly refers to as gender-affirming. It's really sex-rejecting. I mean, we're talking things like puberty blockers, cross-sex hormones, even surgical operations. Before submitting this particular report for peer review, HHS commissioned the most comprehensive study to date of the scientific evidence and clinical practices surrounding the treatment of children and adolescents for gender dysphoria. So what did the report find? And could this potentially mark a turning point in the battle to protect vulnerable children? Well, joining me now to discuss this is the Assistant Secretary for Health at the HHS, Admiral Brian Christine, MD. Admiral Christine, welcome to Washington Watch. We're glad to have you join us, sir.
Jody, thank you so much for this opportunity. And let me start out by saying that there is no way that we could be having this effort to protect the most vulnerable children and their families without the leadership and the direction of President Donald Trump and the strong leadership of Secretary of Health and Human Services, Robert F. Kennedy. They deserve so much praise for taking this head on and leading our country forward to try to reverse the wrongs that have occurred under the last administration, and certainly my predecessor, Rachel Levine.
Well, we give a huge hats off and thank you to them and all of you there who are working to make this wrong right. So let's start off with some of the key takeaways from the report. Can you share some of those with us?
Yes, exactly. So the report was, of course, dealing with the transgender, or rather with gender dysphoria in our adolescents and children. And what was released yesterday were peer reviews of that original report. In other words, we wrote this original report, and then we reached out to a group of 9 scientists, physicians, researchers to give their opinion on the report. And what they overwhelmingly agree with is that treating these vulnerable children with gender dysphoria, treating them with hormones, injections, surgeries that remove body parts and even mutilate these children, this all does not have sound science backing it up. A much better way to treat these children would be with compassionate mental health and psychiatric care.
I think that is extremely worth repeating, that this was a peer-reviewed study. And as you referenced, I believe, 9 different experts, research groups. That's a notable size of peers, isn't it?
Well, it is. Exactly, it is. And this speaks to Secretary Kennedy's commitment for transparency in terms of, as we roll out our healthcare policies and we talk about how to treat individuals in the country, in this case, children and adolescents. Secretary Kennedy wants radical transparency. And what he wants us to do is to be able to reach out to these individuals, these scientists who are noteworthy, and say, give us your opinion. Look at what we've done. Tell us what you think. That's transparency. That's gold standard science. That's what Secretary Kennedy and President Trump want.
I think it's also worth noting that HHS invited the American Academy of Pediatrics and the Endocrine Society to contribute their evidence to this report. Did they come on board with you?
No, Jody, they chose not to. Again, they have an agenda that, in my opinion, and the Secretary's opinion, does not stand for taking care of these children and supporting their families. They did not want to come on board with us.
I think that in itself is a huge statement. You know, we many of us have been watching this for quite some time, and we're thrilled to see where HHS is leading us right now. But we're not the only country that has reached some of the same conclusions as were attained in this report, are we? I mean, this is something that others are coming to the same conclusion.
Yeah, unfortunately, we have countries like England, countries like Sweden, countries like Finland that have actually led the way, and they've been ahead of the United States in realizing, whoa, this is not the right way to treat these kids. We don't mutilate them with surgery. We don't pump them full of hormones. We don't give them medications to really basically reject their sex. They've been ahead of us, and it is certainly long past time that we do this in the United States. But with President Trump, and again, the bold leadership of Secretary Kennedy, we are moving forward. We're charging ahead. We're protecting these kids. These children's parents, they want the best for their kids. And understand that children, adolescents with gender dysphoria, they truly suffer. They truly suffer. It's a real condition. It's a mental health condition. They need emotional support. They need mental support. And frankly, I would say that if their families wish, even pastoral care. But Secretary Kennedy is leading the way forward, and we are going to be now moving forward in this country to protect these kids.
Yep. And I agree. Pastoral care is a huge part of ultimate healing. HHS also, and I commend you for this as well, noted the voices of whistleblowers and detransitioners, if you will, that all of them played such a critical role in drawing public attention to all the risks and harms associated with all of this. But the left really doesn't want anyone to hear those voices. But we can't let that happen, can we? Those voices are critical in this discussion.
No, they are. And when you hear the stories of individuals, young men and women who have been led astray, who have had hormones, or even, unfortunately, these surgeries, these cause rather lifelong, irreversible harm. So we have to listen to these voices. These voices are like a voice crying in the wilderness saying, don't do this to our kids. Listen to what we're telling you. We've been down this road, and it's the wrong road.
All right, less than a minute to go here before a hard break. But in light of this report, what's the way forward now? Where do we go from here?
We're going to continue to lead the way with gold standard science. And as I said, radical transparency. And please, Jody, understand that the response to this report, the reviews, the response has been overwhelmingly positive. The vast majority of men and women in this country, parents, they understand that what's gone on in the past with the prior administration and my predecessor, Rachel Levine, the road that they took them down was wrong. Again, irreversible harm, not the best for these kids. So we're going to continue to lead the way with gold standard science. We're going to continue to help parents understand how the best way to treat these children. And we are always going to stand for these children. President Trump and Secretary Kennedy take very, very seriously, as do I, that we will always stand for these kids. We will always protect these kids. We will always love these kids.
Thank you so much, HHS Assistant Secretary for Health, Admiral Brian Christine, MD. We appreciate your leadership. Thank you for joining us on Washington Watch. Happy Thanksgiving to you.